Hi guys, and welcome to our model on the cell wall inhibitors. In this model, we're talking about the two major drugs classified under the group of antibiotics referred to as cell wall inhibitors. These drugs include penicillins and cephalosporins. It's important to note that these are not the only drugs under the class, but these are the major ones that you need to note in terms of your preparations for GPP. Cell wall synthase inhibitors or cell wall inhibitors are antibiotics that um, tend to have their site of action being at the bacterial cell wall, hence the name. These are drugs that selectively interferes with the synthesis of the cell wall of a bacterium, and as a result, they allow the bacteria to be vulnerable to destruction because the cell wall tends to be one of the protective layers of the bacterium. So if the cell wall is missing or deficient, the bacterium could lyse or could be destroyed by immune cells. As a result of the ability to cause the death of the bacterial cell synthesis inhibitors are usually classified as bactericidal in their uh, way of action. What are the cell wall synthesis inhibitors? These include drugs such as the beta lactams, vancomycin, daptomycin, bacitracin, and polymyxin B. The bacitracin and polymyxin B, however, usually are classified as cell wall disruptors or cell membrane disruptors, and not necessarily cell wall inhibitors. The drugs amongst this list that are actually classified as cell wall synthesis inhibitors include the beta lactams, the vancomycins, and daptomycin, out of which the beta lactams are the most popular drugs. Now, beta lactams are groups of antibiotics that are characterized in terms of their chemistry by the presence of a beta lactam ring. If you look closely at the image just below, you notice that we have a drug, one of the example of a beta lactam, a beta lactam antibiotic. What you notice about the chemistry of any beta lactam antibiotic is that somewhere in the chemistry there is a box-shaped ring that tends to form part of the chemistry of that drug. That box-shaped ring in red is beta lactam ring, and beta lactam ring is seen in four major groups of antibiotics. This includes penicillins, the cephalosporins, carbapenems, and monobactams. Out of these four major antibiotics, the ones that we need to focus on the most would be the penicillins and the cephalosporins. Starting off with penicillins, penicillins are the first antibiotics discovered in history. And around the time, around 1941, was when they were discovered. They were discovered as an extract from a particular fungi called the penicillin notatum. Remember that antibiotics are drugs that are produced by or secreted by a particular microorganism, and they're used to kill another microorganism. In the case of penicillin, penicillin is gotten from the fungi Penicillium notatum and is used in the destruction of bacteria, hence the reason why it is classified as an antibacterial. It's a beta lactam antibiotic, and it's one that is commonly used even till today, regardless of how early it was discovered in terms of history. Chemistry of penicillin is very important for you to note. They frequently test on it in your exams. In terms of chemistry, penicillin, first of all, being classified as a beta lactam antibiotic, should contain a beta lactam ring. What makes penicillin different from the other four beta lactam antibiotics is the presence of an extra ring fused together with the beta lactam ring. So penicillin is made up of a combination of the beta lactam ring and another ring called the thiazolidine ring. So the thiazolidine ring, for example, is the ring shown here. Is the pentagon-shaped ring, as you can see. I'm outlining, and that is attached to this box-shaped ring or beta lactam ring. The combination of the thiazolidine ring and beta lactam ring gives us a new structure called 6-amino penicillinic acid, and that's where we get the name penicillin from. Beta lactam usually tends to contain a side chain, and this side chain tends to be attached to through an amide linkage. The side chain that we see on a penicillin or the beta lactam of a penicillin tends to determine give or confers extra properties to the drug. And this is one way in which we can separate different forms of penicillin from one another. So we have different examples of penicillin, and why penicillins tend to differ in terms of their chemistry tends to be because of that side chain. That side chain is represented by the R group in this particular image here. One extra thing to note, the beta lactam ring present in penicillin is what makes it an antibiotic. If we remove the beta lactam ring or destroy the beta lactam ring of penicillin, it becomes inactive as an antibiotic. What are the classifications of penicillin? Penicillins can be classified in two ways. To classify them as either very narrow spectrum drugs, narrow spectrum, or broad and extended spectrum. This is based on the spectrum of activity. We'll use this particular classification when talking about the examples of penicillin next. Another way we can classify penicillin is based on generation. This is based on what particular penicillin was formed at what particular year. Remember that penicillins were discovered around the year 1941. From that point, we have different forms of penicillin being manufactured. So we tend to group them into generations. We have the first generation occurring within that 1941, then the second generation later on, and the third generation being more recent. Let's talk about the examples of penicillin alongside the classification. We're making use of the classification based on the spectrum of activity. So we'll start with the narrow spectrum, then the very narrow spectrum, then the broad, and then the extended spectrum. The reason why we're starting with the narrow spectrum and not the very narrow spectrum is because of the fact that the narrow spectrum penicillins actually are the first generation penicillins. They're the ones that were first manufactured. And these include the natural penicillins. They're also called natural penicillins because we get them naturally from the fungi. The two penicillins classified as natural or narrow spectrum penicillins include penicillin G, also called benzyl penicillin, and penicillin V, also called phenoxymethylpenicillin. Just a quick properties to note about this narrow spectrum or natural penicillin. First is that the narrow spectrum or natural penicillins are penicillins that are beta lactamase sensitive. I'll explain what that means when we get to resistance. We'll just know that they are beta lactamase sensitive. Second thing to note is that penicillin G tends to be a very acid labile penicillin. It's acid labile, and because it's acid labile, we don't give it orally. We tend to give penicillin G IV or IM. We give it parenterally. So just think about injection. Um, the G that is sounding in injection will mirror penicillin G. So injection penicillin G, that's IV parenteral, which means that it is an acid labile penicillin. Penicillin V, on the other hand, is acid stable, and because it is acid stable, this is a penicillin that is usually given orally. We give it orally because of its ability to withstand the GIT and the gastric acid within the GIT. So this is one very key aspect to note. First of all, that penicillin G is IV and given parenterally because it's acid labile. Penicillin V is given orally because it's acid stable, and both of these penicillin are beta lactamase sensitive penicillin. The reason why we call them narrow spectrum is because they have very narrow activity, spectrum of activity to bacterium. So usually penicillin G and penicillin V are used in treating very mild conditions, very small set of bacterium, including gram-positive bacterium and spirochetes. This is an image of penicillins classified under the narrow spectrum or natural penicillin. So we can see penicillin G shown in this image. You can see it in the bottle form because it's going to be given parenterally. It is acid labile. And we can see penicillin, we'll be seeing penicillin V rather in the next picture in its oral form. This is penicillin V in its oral form. You can see that it's an acid stable drug, hence the reason why we can give it in tablet forms and it will not be destroyed by the gastric acid of the stomach. The next class of drugs are the very narrow spectrum penicillins. These are the second generation penicillins. And these very narrow spectrum penicillins, the reason why they are very narrow spectrum is because we only use them in treating one set of infection. Infection caused by Staph aureus are usually treated by very narrow spectrum penicillin. One extra thing to note about this penicillin is that unlike the narrow spectrum penicillin, the very narrow spectrum penicillins are usually penicillin resistant or beta lactamase resistant. So you can call it beta lactamase resistant or penicillin resistant penicillin. This is contrast to what you see in the narrow spectrum penicillins and penicillins that are beta lactamase sensitive, as I said initially. Examples of very narrow spectrum penicillin include methicillin, nafcillin, oxacillin, decloxacillin, and cloxacillin. One very important thing to note about this set of penicillins, because of the fact that we use them only for one set of bacterial infection, that is staph infection, there's a very high chance that staph could become resistant to this drug. And that's what we see in a particular strain of staphylococcus we call MRSA, which is methicillin resistant staph aureus. So MRSA are set of staph aureus that have become resistant to the very narrow spectrum penicillin, and they're very hard to treat. Usually, MRSA, people that tend to come down with MRSA infection, we can't use any form of penicillin anymore for them. So we tend to give them another set of drug we call vancomycin. Let's go on to the broad and extended spectrum penicillin. Which one we saw classify them further into aminopenicillins, carboxypenicillins, and uridopenicillins just by virtue of particular side group or side chain that is attached to them. So aminopenicillins tend to have an amino group attached to the penicillin. Carboxypenicillin has a carboxylic group attached to the penicillin, and then uridopenicillin has an extra group attached to it. We have two examples of aminopenicillins. These include ampicillin and amoxicillin. These are very common drugs that I'm sure you've heard about. Two differences between the amoxicillin and ampicillin. Ampicillin tends to be given IV, so it's a parenteral drug. Amoxicillin, whereas it's usually given orally, it's usually the drug we tend to prescribe. It has this purple black capsule appearance when you are using it. One thing to note about the aminopenicillins is that the aminopenicillins tend to be beta-lactamase sensitive. Although they are beta-lactamase sensitive, they tend to also have a wider spectrum of activity. So unlike the natural penicillins, aminopenicillins can cover a wide amount of bacterium, including gram-negative alongside gram-positive and spirochetes. Second class of penicillins we have under the broad and extended spectrum are the carboxypenicillin. These are drugs contrast to the aminopenicillins that have an extended spectrum of activity, particularly to set of bacterial infection called Pseudomonas infection. So Pseudomonas infection is caused by a strain of bacteria called Pseudomonas aeruginosa, and it's a very difficult infection to clear. So drugs like carbonicillin and ticagrelin that are classified as carboxypenicillins are drugs that are very effective against Pseudomonas infection, and as a result, we can tend to call these drugs anti-Pseudomonas penicillin. The last set of penicillins we have are the uridopenicillins. These contain a uridic group attached to it. They are also penicillins that have a wide range of activity, particularly covering the pseudomonal infection, and as a result, we call them anti-pseudomonal penicillin. This includes piperacillin, methicillin, and azlocillin. Just for us to remember that most of the broad spectrum penicillin, broad and extended spectrum penicillins, like our aminopenicillins, carboxypenicillins, and uridopenicillins, alongside the natural penicillins, tend to be beta lactamase sensitive. And I said I was going to explain what beta lactamase mean in terms of resistance. We'll talk about that very soon. But note that because these penicillins are beta lactamase sensitive, usually we tend to combine them to another set of substance, a beta lactamase inhibitor that would boost the activity. So beta lactamase, just to note, are enzymes produced by the bacteria that we're trying to treat. And this bacteria produces these enzymes. The enzymes that are produced will destroy the drug before the drugs can act on the bacterium. And these particular enzymes are called beta lactamase enzymes or penicillase enzyme. Now, for drugs like naturally acting penicillin or natural penicillins rather, which is what we call the narrow spectrum penicillins, and then the broad spectrum penicillins, because they are beta lactamase sensitive, they can easily be destroyed by enzymes found within any of the bacteria that contains them. So one way in which we can prevent the destruction of the drugs and prevent the resistance of the bacteria to the drug is by joining the broad spectrum penicillins alongside, or the natural spectrum penicillins alongside the beta lactamase inhibitors. And these inhibitors include drugs like clavulanic acid, sulbactam, and tazobactam. These are very important. We'll talk about the combination of each of these drugs in the next slide. So the common form of combination we have for the broad spectrum penicillins alongside the natural penicillins, when we combine them with the beta lactamase inhibitors, the set of combinations we could get includes drugs like augmentin. Augmentin is a very common drug. We tend to use it. In fact, commonly, of recently, it has been a drug that is out of market in Nigeria because of how expensive it is. Cimentine is also very commonly used outside of the country. Oancin and Zeucin are also commonly used. These drugs are combinations between a beta lactamase inhibitor and a broad spectrum penicillin. So you can see the combination of amoxicillin and clavulanic acid will give us co-amoxiclav, what we call augmentin. Combination of ticagrelin and clavulanic acid will give us timentin. Combination of ampicillin and sulbactam will give us unacin, and the combination of piperacillin and tazobactam will give us zeucin. The mechanism of action of penicillin is straightforward. The penicillin is a cell wall synthesis inhibitor, so the final goal of penicillin is to destroy the process of the synthesis of the cell wall of bacterium. How it does this is by acting on a very important enzyme used by the bacterium in production of the cell wall. So this enzyme is called the transpeptidase enzyme or the penicillin binding protein. So we can call it either of that. All right, this enzyme is responsible for the last step of the in the production of the cell wall of a bacterium. This step is called the step of transpeptidation or cross linkage. So this step is important for the cell wall to be fully formed and to be strengthened when it is produced within the by the bacterium. And without this step occurring, without transpeptidation and cross linkage of the peptidoglycan cell wall occurring, the cell wall that is formed is going to be very weak, osmotically unstable, and it can easily lyse. And that lyse is what leads to the death of the bacteria. And that's why we say that penicillins are bactericidal, because once penicillin enters into the bacterium, they bind on the transpeptidase enzyme or what we call the penicillin binding protein. They prevent the last step, which is transpeptidation or cross linkage, from occurring, and as a result, they allow the cell wall that is formed to be unstable, to be deficient, and easily prone to cell lysis. And once cell lysis occurs, the microorganism is said to automatically die. This is a picture of the bacterial cell wall and the peptidoglycan chain, which tends to be cross-linked by that last step we call transpeptidation or cross-linkage. That is usually done by the enzyme transpeptidase enzyme or what we call penicillin binding protein. This is shown or represented in the image by this brown structure here. The interaction of penicillin is shown here, with that particular enzyme, the penicillin binding protein or transpeptidase enzyme, will lead to the will lead to a halt in the synthesis of the cell wall and eventually possible destruction of the cell wall and lysis of the cell and death of the bacteria as a result. What are the indications for penicillin? Penicillin tends to be used for a number of infection, usually infection that deals with different aspects of the body, like urinary tract infection can be treated with penicillin. Respiratory tract infection are usually treated by penicillin. Meningitis, we prescribe penicillin for meningitis caused by specific bacteria. So gram-positive and gram-negative bacteria we can treat with penicillin. Gonorrhea, we can treat penicillin. Syphilis caused by Treponema pallidum, which is a spirochete, can be treated using penicillin, usually the natural penicillins or the narrow spectrum penicillins. Diphtheria, which is also a type of respiratory tract infection, alongside tetanus and gas gangrene, are usually treated with penicillins. It's better for us to learn about the spectrum of activity of penicillin, starting with the very narrow spectrum penicillins. The very narrow spectrum penicillins are drugs that tend to act against only one set of microbe, and that particular microbe is Staphylococcus aureus. This is the reason why we tend to classify very narrow spectrum penicillins as anti-staphylococcal penicillin, because of how they have just a single activity against one microbe. The narrow spectrum penicillin, penicillin G and V, are active against only gram-positive organisms, particularly gram-positive rods and gram-positive cocci. And these are the organisms in which they are very active against. So organisms like Neisseria, meningitis, gonorrhea, organisms like Staph aureus and strep bacterium are usually organisms that are susceptible to damage by the narrow spectrum penicillins. When we go to the extended and broad spectrum penicillins, we have more bacterium being covered. Both extended and broad spectrum penicillins tend to cover gram-positive, gram-negative rods and cocci alongside spirochetes. Spirochetes are the causative organisms or conditions like syphilis. Treponema pallidum is an example of spirochete, and you can use drugs like penicillin G and V alongside some of the broad and extended spectrum penicillins in treating spirochete infection. Let's talk about resistance to penicillin. Resistance is defined as the ability of a microbe to resist destruction by a particular antibiotic. In the case of penicillin, different microorganisms tend to form mechanisms by which they can resist the destruction by penicillin. These mechanisms include one, formation of an enzyme called beta-lactamase that will destroy the drug before the drug gets destroyed the bacterium. Then there's an alteration of the penicillin binding protein, which is the target site of penicillin. So we have the microbes altering that transpeptidase enzyme and then preventing penicillin from binding to that enzyme. This is one way in which they can resist destruction from penicillin. And then finally, decrease in the permeability to the drug. This is one way in which, because penicillins, for them to work, they need to enter into the microorganism. And one way in which the microorganism could resist destruction from penicillin is by reducing the amount of penicillin that enters into their cytoplasm. And this is extremely very effective. There are two ways in which it could occur. Either through the use of what we call an efflux pump, or through reduced intake of the drug into the cytoplasm of the bacterial cell. These are just images showing us the different types of resistance and mechanism of resistance to penicillin. The first would be production of an enzyme called beta lactamase. Beta lactamase enzyme is there to destroy the beta lactam ring of the penicillin. Once this beta lactam ring has been destroyed by beta lactamase enzyme, what happens is that that particular drug becomes defective, becomes uh, useless. Because remember that beta lactam ring is the reason why penicillins have antibiotic effect. If the beta lactam ring is destroyed, usually by beta lactamase enzyme or penicillase enzyme, the drug is as good as useless. Then remember that aside the inactivation of the drug using enzymes, you could also have efflux pump or reduced accumulation occurring. This will decrease the amount of drug present within the cytoplasm. So you can see on one end, you can see the efflux pump pumping out antibiotics out of the cytoplasm into the extracellular space. This is to reduce the accumulation of drug into in the cytoplasm and then reduce the activity of the drug. Another way in which you can have resistance is that the microbe could change the target site of the drug. Target site in this case is the penicillin binding protein or transpeptidase enzyme. So once the microbe changes that binding site, changes that target site, the drug will not be able to interact with the target site and will not be able to perform its work in terms of the destruction of cell wall process of the bacteria. Adverse effects of penicillin are numerous. One important thing to note about penicillin is that it's a very, very safe drug. Penicillin has one of the largest TI I would see in pharmacology, and as a result, it's very rare to see adverse effects occurring when using penicillin. However, we do tend to see adverse effects in some individuals. So some of the adverse effects of penicillin includes hypersensitivity reaction. So this includes allergic reactions to drugs classified as penicillins. This could come in different fashion. It could come as lip swelling, it could come as rash, it could come as photophobia, it could come in different ways, it could come in different fashion of toxicity. Other forms of adverse effect could be diarrhea, neurotoxicity, hematological toxicity, interstitial nephritis is a very common side effect, and then seizures are also side effects. But overall, adverse effects of penicillin is relatively rare because of how large the TI of penicillin is and how safe the drug is considered to be.
Besides penicillin, another very important beta-lactam antibiotic that you should know very well for your exams um, would be cephalosporin. Cephalosporins are antibiotics that have been said to be derived from the plants Cephalosporin acrimonium, and that's a fungi that we extracted the substance from around the time of or 1948. So you can see it's just a few years after the discovery of penicillin, we discovered a new product which has a very similar chemistry to penicillin. Cephalosporins are classified as beta-lactam because of the presence of the beta-lactam ring. Remember that beta-lactam ring is a box-shaped ring found in the chemical structure of beta-lactams. But alongside this beta-lactam ring, what makes cephalosporin very different from the rest of the beta-lactams is the addition of an hexagonal shaped ring called the dihydrothiazine ring. So when we combine the hydrothiazine ring plus the beta-lactam ring, we get a new product called 7-amino cephalosporinic acid, and hence the reason why we call substances derived by this particular way, we call them cephalosporins because of this cephalosporinic acid in the name. So this is different from what we have in penicillin. Remember, for penicillin, it's a thiazolidine ring that combines with a beta-lactam to form 6-amino penicillinic acid. In the case of cephalosporin, it's a dihydrothiazine ring that combines with a beta-lactam to form a 7-amino cephalosporinic acid. Also remember the difference between a thiazidine ring and dihydrothiazine ring. Dihydrothiazine ring tends to be hexagonal in shape, and the ring that we see for penicillin tends to be pentagonal in shape. The beta lactam we see in cephalosporin also has a side chain, and that side chain tends to confer extra properties to the different classes of cephalosporin that we have. Let's talk about how we classify cephalosporins. Cephalosporins are classified based on generation. So we talk about first generation being the first set of cephalosporins formed. Then we have the second generations. This were derived or manufactured around 1950s, around the 1950s. Then the third generation around the 1960s, and then fourth generation, the most recent drugs in the market. Examples of first generation cephalosporins include drugs like cefalexin, cefradin, cefazolin, cefadroxil, cefalutin, cefapirine, cephaloridine, and cefalutin. And what you would notice about each of those drugs is that all the first generation drugs tend to have a cepha starting them. So they have a prefix um, that begins with cepha. The cepha is either spelled CEFA or CEPHA. So we can either spell it in that or once you see any drug that is spelled with a prefix of cepha, you should be thinking about the first generation cephalosporin. The only exception to that rule is the drug cefaclor. Cefaclor is a drug that begins with cepha but is not classified as a first generation cephalosporin. In fact, it's the second generation cephalosporin. And we'll talk about that next. Second generation cephalosporin include drugs like cefuroxime, which is very commonly used. Cefaclor. Cefaclor is the only second generation that has the cepha in its name, and it's the exception to the rule of first generation drugs. Cefoxitin, ceproxil, cefonicide, cefotitan, and cefuroxime, or cefuzunam rather. So these are examples of the second generation cephalosporins. We'll talk about their spectrum of activity and how they differ from the first generation in the next couple of slides. Third generation cephalosporin include drugs like cefotaxime, ceftizozime, ceftriaxone. Ceftriaxone tends to be the most common third generation drug. See it being prescribed uh, very well in this part of the world. And we have ceftazidime, cefoperazone, and cefixime. What you notice about each of the third generation is that they have a very unique suffix. Most of the drugs have unique suffixes. So it's either they're ending with a zine, so drugs like cefotaxime, or they're ending with a zone, so drugs like ceftriaxone or cefoperazone. So they're ending with a zone. The zone can either be an X or a Z, right? Or so we have a zone, a zim, and this tends to be the unique suffix that we tend to see for cephalosporin. The exception to that rule tends to be ceftazidime, which is the only one that doesn't have a zone or a zim ending it, but a dim ending it, making it very different from the rest. Finally, we have the fourth generation cephalosporin. These include drugs like cefepime, cefirom, cefozopran, and the likes. These are not commonly used drugs because of how recent they are. We usually prefer using the third generation drugs, but except we have a very difficult infection to treat, then we take it a step further and we start to use fourth generation drugs and even fifth generation drugs, which are relatively new. Examples of fifth generation drugs, although I didn't mention it in the classification, include ceftobiprole, ceftaroline, ceftolozane. And these are all drugs that are very relatively new and not commonly seen in this part of the world. What's the mechanism of action of cephalosporins? This is extremely similar to what we see for penicillin. Cephalosporins tend to be classified as beta lactam, and it has very similar activities to penicillin just by virtue of the presence of the beta lactam ring. Remember that penicillins act on the transpeptidase enzyme or the bacterium, or what we call the penicillin binding protein. This site is also the same site where the cephalosporins will be working on. So the beta lactam ring in the cephalosporin would bind on the transpeptidase enzyme of the bacterium and prevent the enzyme from doing its work. The work of the enzyme is for is for completing the last step of bacterial cell wall synthesis, the step called transpeptidation or cross linkage. So once cephalosporin inhibits the enzyme, transpeptidation and cross linkage will not occur, and as a result, the cell wall will be produced, but it's going to be deficient. And that last step is there to strengthen the cell wall. If the cell wall is deficient and the last step does not occur, that the cell wall becomes very fragile and osmotically less stable. This can allow for vulnerability of the cell wall and eventually cell lysis of the microorganism. And this is why cephalosporins tend to be classified as a bactericidal agent because of its ability to cause cell lysis in the microbe. This is just a picture of the bactericidal effect of cephalosporin. Remember, its work is to prevent the cross-linkage of the peptidoglycan cell wall, which strengthens the cell wall, and that would eventually lead to vulnerability of the cell wall and eventually lysis um, of the bacteria. What are the indications for cephalosporins? Because they have very similar mechanism of action to penicillin, they have alternate use to penicillin. So, in case someone is having a reaction to penicillin, or the person is not able to get penicillin, a better option could be cephalosporin. Every single condition, or most of the conditions that penicillins are used in treating, cephalosporins are also very effective. So they tend to be second line drugs for penicillins. We can also use cephalosporin to treating septicemia, surgical prophylaxis. So in case you've been to surgery, one of the drugs that we tend to prescribe to patients that are either completed surgery or about to go into surgery tends to be ceftriaxone, the third generation cephalosporin. And this would help in reducing the chances of having surgical site infection or infection at the uh, period onset of surgery. You can use it in other conditions like typhoid. Previously, cephalosporins tend to be the was was known as the drug of choice for treating typhoid fever, but is no longer the drug of choice. However, we can still prescribe it in case the actual drug of choice, which are fluoroquinolones, are not effective. And then we can use cephalosporins in treating soft tissue infection, which is, you can see in many areas like surgery, burns. Prefer to use cephalosporins as the drug of choice. Let's talk about the spectrum of activities for cephalosporin. Remember, we have up to 4 generations or even 5 generations of cephalosporin. Each of them have different spectrum of activity. First generation cephalosporins are notorious for being effective against mostly gram-positive microbes. Second generation tends to differ because second generation is mostly effective against gram-negative microbes alongside anaerobes. So this is very important to note. So drugs like sulfatitan are very effective against anaerobes. So anaerobes like Bacteroides, fragilis, like Fusobacterium. So anaerobes tend to be very notorious for causing septicemia. Remember that one of the indications for cephalosporin use is septicemia. So in the septic case, one of the drugs we can prescribe is a second generation cephalosporin that will help in clearing the anaerobes. Third generation cephalosporins tend to be effective against gram-negative as well, alongside the very stubborn infection called Pseudomonas aeruginosa. Remember that infection? We talked about it when we were talking about some of the broad-spectrum penicillins, right? And usually, fourth generation cephalosporins are effective against gram-positive alongside Pseudomonas aeruginosa. So it's kind of there's an increase in the activity against Pseudomonas as we go from second generation to third to fourth. Another very important thing to note is that from first generation to second generation, these drugs tend to be beta-lactamase sensitive. Second generation tends to be a little bit resistant, but when we compare it to third generation, it's kind of sensitive, if I can put it that way. Third generation cephalosporins and fourth generation are usually beta-lactamase resistant, and this is very important to note for your MCQs. Okay, note which particular generation of cephalosporins are beta-lactamase sensitive, which ones work against gram-positive, which one works against gram-negative, which ones are beta-lactamase resistant, which ones are involved in treating pseudomonas infections, which ones are involved in treating anaerobic infections. Resistance to cephalosporin is not different from the resistance that we see to penicillin. So the three major mechanisms of resistance to cephalosporin includes the production of the beta-lactamase enzyme by the bacteria. Bacteria can produce the beta-lactamase enzyme, and that particular enzyme would destroy the beta-lactam ring found on cephalosporin, hence rendering the drug to be useless. There could also be an alteration in the protein binding sites, in the penicillin binding sites to cephalosporin. Remember that cephalosporin and penicillin work at the same site, what we call the transcriptase enzyme. So if the bacteria can alter this particular site, it renders cephalosporin and penicillin useless as a result. And then finally, there could be a decrease in the permeability to the drug into the cytoplasm of the bacterium. So it's either through the use of efflux pump to pump out the drugs that have already entered into the cytoplasm, or just by virtue of reducing the entry of drugs directly into the cytoplasm of the bacterium. These are ways in which the bacterium could resist the action of cephalosporin, hence making it to be very, very useless. Adverse effect of cephalosporin also tends to be similar to what we see in penicillins. In fact, when we talk about one of the very common adverse effects, which is a hypersensitivity reaction, we usually say that there's a 20% chance that when someone is reactive to penicillin, they could also be reacting to cephalosporin as a result. Aside from hypersensitivity reaction, diarrhea could also be a side effect. Interstitial nephritis, although not commonly seen, is a side effect of cephalosporin use. Neurotoxicity, hematological toxicity, and then most importantly, superinfection is a common side effect of cephalosporin. What I mean by superinfection is the fact that cephalosporin being an antibiotic can be extremely strong on the GI, and it would lead to the destruction of normal flora within the GIT. Once the normal flora within the GIT is being destroyed, or when we have alteration in the normal flora of the GIT, we have some microbes that are normally dormant. Uh, we have them beginning to propagate themselves and proliferate within the GIT, and that will have we have a superimposed infection as a result. We usually see that with the bacteria Clostridium difficile, which is notorious for causing the condition we call pseudomembranous colitis. That's when we take an antibiotics and the antibiotics disrupts the normal flora of the GIT and allows for Clostridium difficile to start to proliferate um, harmful rates. And that harmful rate of proliferation will lead to the condition we call pseudomembranous colitis. I think I might have shown you guys already in the previous module under the introduction to antimicrobial pharmacology. So please check up on that and you see a picture of how the GIT looks like once there's a superimposed infection due to the use of an antibiotic like cephalosporin. And that concludes our module on the cell wall inhibitors.